Anse, Wagumaganak. I just want to share a little bit for you today here. This is the KCN video update for March 27th, 2020. First off, I'd like to thank and send gratitude to all membership who have been taking the COVID-19 pandemic seriously. Social distancing, together yet apart, we can overcome this. First thing this morning, several Kehewin elders organized a prayer to begin the day. Shortly after, the Emergency Management Committee consulted with Ukamawan Council, local RCMP, and department heads, who've made the decision to monitor Kehewin's incoming and outgoing traffic in what they are calling a soft check stop. From EMC headquarters, here's the Director of Emergency Management, Dion, with more information on today's decision.
Thank you, Kevin. So what we're going to be doing this weekend, starting on Saturday around 12 o'clock, is we're going to start setting up what we're going to call checkpoints. So we're going to be starting to monitor who's coming into the reserve and to start to curb the travel of people moving around. And so basically we're going to have separate points, which we're going to start off down. We'll start off in the, look at that. It starts off on the south side. I did not know it did that. So we're going to go down in towards this area, which is down by House 13 by Roland Dion's. We're going to have a roaming checkpoint in here. There's not too many people, but this right here, where the what we call I missed the road, where the dump road is, we're going to have a checkpoint there. And so basically what they're going to be doing at the checkpoint is that I have given the safety watch people to ask a few questions, and those are pretty basic questions, and then we'll go from there. So we're going to have one over at the dump road, which is right down in this part of the area, and then we're going to have another checkpoint here over by what I would call Road 2, and this is actually the North Beach Road, and then we have the Road 2 up in this area, which is where the Gadwas live. We'll have a checkpoint in here, and then we're going to have a checkpoint on Highway 657 West, and that one's going to be a little bit more detailed questions. We have a lot of traffic that comes across the reserve, so we're going to set up right in this little area here by William Dion's place. The other checkpoint that we're going to have is going to be over on the east side of the reserve on Highway 657, where we're going to have the same place there to do the checkpoint there, and up around what we would call the Gurneville Road, which is over by St. Joseph's Hill, also another checkpoint there. So the purpose of this is just it's like what other First Nations are doing around us, and to be able just to see who's coming in the community, if there's any questions that they have that we should be aware of. The other part is that we'll be also coordinating with the Bonneville RCMP. So these checkpoints are going to be 24/7. So they're going to go from daytime and nighttime for just to monitor and keep our community safe, and just to see, and it also adds up to what we as the committee may need to see what other services that we may provide, like maybe a hotshot service or something like that, so we can have, cut down the travel on the highway. The big message here is to be able to stay home, and to stay home and stay safe, and just the protection of our people. And so we're doing this next move to help. Thank you.
Thank you, Dion. Several First Nation communities across the country have been implementing their own checkpoints, and in some cases complete lockdowns of their reservations. Kehewin Ukamawan Council and the EMC trust the membership to practice safe social distancing and reasonable traveling at times like this. We recognize the need for some band members to travel to and from work to pick up their prescriptions, medications, and also those wishing to return home. The main concern for the soft checkpoints is to monitor who's coming in and off the reserve, where they came from, and the main focus is to prevent COVID-19 from entering the reservation boundaries. The virus poses a health risk to our membership, With this, we have a health update from the Director of Health, Connie Morin.
You are likely keeping yourselves informed and updated about the COVID-19 virus through all forms of social media. I'm here to provide you with an update specific to our nation. Currently, we have no known cases of community-acquired COVID-19, and we want to keep it this way. Every person in Kehewin is valuable, and we need to protect all of our members. Even losing one person from COVID-19 will be a great loss. During this time, we will need our nation to rally together like we have never done before. Our people have survived times like this in the past with previous epidemics, including smallpox, tuberculosis, measles, and others, and we will get through this one too. Together, we are strong. We come from a strong line of people who have survived much adversity, and they have helped to bring us where we are today. We are doing this keeping in mind our 7 generations to come. Having said this, we know that COVID-19 is occurring in greatest numbers in the age group 18 to 29 because they are not taking the social distancing recommendations seriously. Young people, we need you to stop gathering as this increases the risk that you will bring this back to our homes, even though you may feel well and have no symptoms. We need people to stay in their homes and in their immediate environment. If you are going to visit with others near to your home, it needs to be outside and at least 6 feet away. We encourage people to go for walks outside, to be out on the land, but to do this with the appropriate social distancing. Think ahead. If anyone in your household has symptoms of ILI, influenza-like illness, please immediately self-isolate in an area of a home that includes your own bedroom and washroom. No one else should go into these spaces while you are self-isolating. If you do not have these facilities, please set up a teepee, trapper's tent, your holiday trailer or camper in anticipation that this might be used for someone in your family who is suspected of having COVID-19. If you have symptoms, please contact the Alberta Provincial Health Line at 811 and a health worker will assess you for the need to be swabbed for COVID-19. Please note, Kehewin Health Services will not be equipped to handle more than essential services at this time and will work closely with the Bonneville Hospital or Elk Point Hospital as the need arises. In relation to home care services, a CHR is delivering medications to the door as scheduled. Please note that individuals need to discuss with their doctor and pharmacist to arrange for this. Urgent home care is being provided. In regards to medical transportation, our medical vans only operate to assist clients under specialized care like dialysis and chemo for cancer patients. Our coordinator is working from her home and may also assist with postponing appointments that were arranged through Kehewin Health Services prior. Prenatal clients will continue to be supported with regular phone calls, and Kehewin Health Services may assist in emergency situations for formula, milk, and diapers. We thank Deb Jackson for maintaining her practice through telepsychiatry. Please call her directly at 780-614-1622. For Kehewin clients, she will arrange appointments from 8:30 and 4 p.m. on Mondays and Wednesdays as per her usual hours. Please note this is not a crisis line. To assist with social isolation, we recognize and have implemented medication pickup by request on reserve as an essential service from both Bonneville and Elk Point. Please note that at this time we cannot provide any health services for anyone residing off reserve, and trust that provincial health services are available where you live. As part of the overall emergency management response, Kehewin Health Services is also part of the 1833 phone line and website interface to respond to health-related needs. With that, I urge you to stay calm, stay safe. Aye.
Thank you, Connie Morin. Today, social development and community volunteers have been working hard all day to get food hampers out to the community. Heading over to the rec center now, it has been transformed into the food distribution center. Here's an update of how it's going.
So what's happening here today? How's it going?
Well, we're doing a lot of unpacking and packing and delivering food to the houses. I got a good crew here going. I had about 300 water bottles, 300 cases of water, milk, meat. We don't have too much manpower here, but it's all right. It's going pretty good.
You guys think you'll be finished today?
I doubt it. We still have a lot of work to do. We still got to get all the packages to families. So still a lot of work. Whoever is coming out to help is really helpful. Yeah.
Thank you, Kim John and Kehewin Social Development, for all your hard work. The community appreciates it. After today's delivery, Kehewin Social Development's next food distribution will take place on April 10th. In closing, we will leave you with a song from Grey Eagle, Jodi, Windy Boy, Cindy, and Clyde. Thank you, and please have a safe weekend. God bless you.
For any updates, information, or if you have any symptoms of the COVID-19 virus, please call or text the Kehewin toll-free helpline 1-833-Kehewin, 1-833-534-3946, or visit www.833kehewin.ca.